Welcome to the stage at this time the Honorable Representative from Virginia, Bobby Scott. It's going to be short. Congressman Scott asked me how many cups of coffee you've had, and I said, well, anyway, I'm going to make this very short because of votes going on in the House. But Bobby Scott will soon become the ranking Democrat on education workforce. It's a committee I deal with each and every day. No one fights harder for values. For working families, for education, for early childhood education, for poverty, than Bobby Scott. The Hill, which is this sort of Washington, D.C. newspaper, named of all the 435 members, a couple years ago in the House, named Bobby Scott one of the 10 hardest working members in Congress. I think that's true. But let me very quickly point out two things to you. One is that he has successfully led efforts for the House to pass the Fair Sentencing Act, which has reduced the outrageous penalties on crack and powder cocaine and the disparity with that in our prisons. And he's also one of the leading critics of warrantless wiretapping going on in America. So he fights for civil liberties, but he also fights for opportunities as well. So this is getting over here from votes in the House on a busy day. It means a lot to us. Let me introduce to you one of the truly, truly outstanding members, House of Representatives, Congressman Bobby Scott.
Thank you.
You're welcome.
Thank you. Thank you, David. Thank you, and I'm so glad I can make it. An hour ago, I think I sent a message that I can't make it because we've got votes, and it's just impossible. And we were watching the screen, waiting for them to call the vote, and the presiding officer said, mumbled something about the bill is passed. And then they went on to the next bill. This one was supposed to take about a half an hour, 45 minutes worth of debate, and they just passed it on a voice vote, which gave me the half hour, 45 minutes I needed to get here. So I'm so happy that they did that. And I feel right at home because when I was in law school, one of the summers I worked at the Office of Human Affairs in Newport News, Virginia, a community action agency with the Neighborhood Youth Corps. And I know I was successful because one of the enrollees I'd see every couple of years is now a member of City Council on Newport News City Council. And so you see your work, and she remembers it. She remembers the little counseling we gave her. Wasn't much, but apparently it worked. I just feel right at home. And I want to thank you for all that you do for people in need, giving them a hand up, not a handout, to make sure that they can learn how to fish and not teach them how to fish so they can feed themselves for a lifetime, not just give a fish. And it's a community action agency that does that so well. I know one of the things that we are challenged with right now are choices. And sometimes we don't get around actually making the choices. We just do things sequentially, and choices effectively get made without really coming to grips with the choices. I know last year I was very critical of the fact that we extended $3.9 trillion in tax cuts without a clue as to how we're going to pay for them. And so the question was pretty much, how would you like a tax cut? Nobody asked the follow-up question, well, how are you going to pay for it? Reminds me of, I don't know, how many people are here from Virginia? All right. Give Virginia a hand. Some of my Virginia friends may remember Ed Willey, who was the chair of the Senate Finance Committee when I was in the state Senate. He had a well-deserved reputation as a conservative. Well, he was tell the truth, he was stingy. Word was you couldn't get a dime out of him with a crowbar, and people hated him. He went into a bar right before an election, as Jerry Blouses, the former governor, tells the story. He went into a bar right before an election, and he heard the people mumbling. Oh, there go Ed Willie. Nobody in here going to vote for Ed Willie. Can't get a dime out of him with a crowbar. I don't know why he bothered to come in. He just mumbled, and they didn't even keep their voices down. He was listening to them. And so he turned to the bartender, lifted his beer, and said, "Bartender, when Ed Willie drinks, everybody drinks." People couldn't believe it. They said, "Ed Willie set up the house. Look at this." Oh, they started cheering, "Ed Willie, Ed Willie." Why are you talking bad about Ed Willie? He's got every vote in here. Set up the house like this. Oh, they were just cheering. And in the middle of all the cheering, Ed Willie took a couple of dollars out of his pocket, put it on the bar, and said, "Bartender." Everybody looked up. "Bartender, when Ed Willie pays, everybody pays." Well, that's what happened on these tax cuts. Everybody got a tax cut. Oh, people were slapping each other on the back. Oh, look what happens when you give everybody a tax cut. Bipartisan, isn't everybody happy? And then within 2 months, people said, "Well, what are you going to do about this sequester?" All the cuts right across the board. What are we going to do about talking about cutting Social Security and Medicare? Talking about cutting education, talking about cutting the safety net. All these cuts, which individually don't amount to a rounding error on a $3.9 trillion appropriation, all of a sudden we're trying to come to grips with what we have to do. They keep saying you got to cut Social Security. You got to address entitlements. Well, you never hear any numbers. The number on Social Security cut is a change CPI, which is about $0.1 trillion. The Medicare cuts, they're talking about raising Medicare and all that, the numbers come in at about $0.1 trillion. Well, add them up, that's 0.2. Why don't we pass, instead of a $3.9 trillion tax cut, why don't we pass a $3.7 trillion tax cut and leave Social Security and Medicare alone? That would have been a choice. But we never got around to making the choice. We cut the taxes first and then look around, oh my God, we're broke. How are we going to pay for it? Now we got to cut Social Security and Medicare without coming to grips with the fact that that was actually a choice. And if you look at all of the things that we're making choices with and the kinds of things in education and child care and safety net and job creation, we're not coming to grips with the choice. I think if you put a choice, if you put a, say, $3 trillion tax cut and spent $900 billion in health care and education and transportation and job creation and leave Social Security and Medicare alone, and then a $3 trillion tax cut, I think everybody would have taken that rather than 3.9 and then having to cut everything. But we have to make sure that people come to grips with the choices that are being made, because choices are, in fact, being made. We're making choices, for example, on health care, that we finally passed, after 100 years of trying, comprehensive health care. I mean, Teddy Roosevelt, much less Franklin Roosevelt, had a universal health care idea, and then Franklin Roosevelt, all the way to 100 years of trying, we finally, 4 years ago, passed Obamacare, which provides access to affordable health care for everybody, regardless of income, regardless of pre-existing condition, regardless of age. Everybody has access to health care insurance. Now the debate is whether we're going to repeal it or not. And so the choice has got to be made. Well, if you repeal it, what are you going to do for those with pre-existing conditions finally got insurance? What are you going to do about young people, 26, on their parents' policies? What are you going to do about the fact that you can get now free annual checkups and cancer screenings without a copay and deductible? What are you going to do about the fact now that there are no caps on policies, that if you are very seriously ill and about to max out your policy, no more maxing out, they got to keep paying. They can't leave you high and dry after they paid $250,000 or $500,000. They have to keep paying. What about no rescission, where the insurance companies would rescind your policy after they got tired of paying your bills? They just say, well, we're not going to renew you, or we're going to cancel you midstream. All of that we've taken care of. Do we want to go back? And we want to make sure people know that choices are being made. When you vote to repeal, these are the kinds of benefits that you're repealing. People that could never afford insurance. If you don't have insurance on your job, there are very few people that can buy or can afford private insurance on their own, individual insurance. And now you go on the marketplace, you get it at the standard rate, just like it was a large group policy. You're paying a nice fee, regardless of pre-existing conditions. You can get a policy like everybody else. Now, we're making choices, and we want to make sure we keep it. Now, one of the problems we got just as a politician, you listen to the discussion about Obamacare, all you hear is about the website. It didn't work. Okay, we agree on that. It works now, but it didn't work. People claim to have lost their policy. They wanted to keep the policy. Well, you find that most of the people that are whining about that, now that the website's working, they're getting better coverage with less money. So, I mean, and in fact, all these TV ads you see, when they actually investigate the case, they find out that the facts presented weren't true. These are people they picked. I mean, and then find out, no, they could have gotten a cheaper policy. No, they didn't lose their policy because of Obamacare. They lost it because the insurance company didn't want to sell it to them. And all these things that just weren't true. But we're making choices. Now, I serve on the Education and Workforce Committee, but I also serve on the Judiciary Committee, where I'm now the lead Democrat on the Crime Subcommittee. And talk about choices, those are choices. Basic choice is we can reduce crime, or we can play politics. We're good at both. And unfortunately, we've been codifying all these simple-minded slogans and sound bites, and now have lock them up and throw away the key, where we lock up a higher portion of our population than any country on earth by far. The Pew Research Center has looked at it and says not only are we in first place, we're so high that instead of reducing crime, because we're locking up so many people, messing up so many families, having so many people wandering around the community with felony records, can't get jobs, that we're actually adding to crime rather than reducing crime. The incarceration rate, wasting all that money on incarceration, is actually counterproductive. Well, we know if we put some of that money into prevention and early intervention, into early childhood education and after-school programs, and get young people out of what the Children's Defense Fund calls the cradle-to-prison pipeline, and get them into a cradle-to-college and career pipeline, they wouldn't get in trouble to begin with. And so we're making that choice. I've introduced the Youth Promise Act, which would fund comprehensive, locally tailored, evidence-based approach to reducing gang violence. And we put evidence-based in there where you say, well, evidence-based, well, opposed to what? Well, opposed to the slogans and sound bites that you'd be funding if you didn't put evidence-based in there. But we know these programs, comprehensive programs, work. In Boston, they put a little comprehensive program together after they've gotten sick and tired of watching children die through violence. About 12 or 13 a year over several years were dying, about one a month. They came together with a comprehensive initiative, prevention and early intervention oriented, and went 3 years without a single juvenile murder. We know they're cost effective. We know in Richmond, they had 19 murders one year, got together in the neighborhood, reduced it to 2. And just think of all the money you saved at the Medical College of Virginia, not having to treat all those gunshot wounds, and other criminal justice system and all the incarceration that you avoided. We saved, I'm sure, more than the $2.5 million that we spent on that program. Pennsylvania's funded about 100 programs at $60 million. They went back, and by the time you reduced teen pregnancy and other problems, and as well as crime, they figure they saved about $300 million, spent 60, saved $300 million in costs. So we know they work, they save more money than they cost, and the Youth Promise Act would provide that. But we know, and I want to thank you for all that you do, for getting our young people on the right track, keeping them on the right track, making sure that the adults have the social safety net that they need, making sure they can become self-sufficient. You've been doing it for 50 years. Thank you for all that you've done. Thank you.